So in this video, I'm going to be describing a step-by-step of how to administer enteral feeding. I don't have an enteral feeding solution nor an NG tube or G tube in order to physically demonstrate how to do this, but I'm just going to kind of explain how to do it if I were in a clinical setting in a step-by-step format. And the first thing that I would do, just like with any other procedure, is I would, of course, identify the patient in the physician's orders, make sure they match, and I would also check to see if the patient has any allergies, because that could be important when it comes to the enteral feeding process. And then once I do that, I am going to go into the room, perform hand hygiene, kind of explain what I'm doing, and then when I am preparing the enteral solution before I actually administer it, I want to be sure to get the cans and shake them up and then put them in the actual feeding bag and prime the tubing before I ever connect it to either the NG tube or the G tube. And then after that, I'm going to place the patient in a high Fowler's position to kind of prepare them for the process. And then once I do that, I want to make sure that the NG tube that I could be using is in the correct place, because we wouldn't want to put enteral feeding into the wrong area of the body. So we would do that by checking the gastric residuals, and in order to do that, you would aspirate from the NG tube and you would check the pH with pH strips. And you also want to check for how much residual is actually in there, because you don't want to administer an enteral feeding if there's an excessive amount of gastric residuals. So if there is 500 milliliters or more in any one read, or if I say one read, one aspiration, I guess you could say, or if there is two consecutive 250 milliliter amounts or greater an hour apart, then you will not continue the feeding. But if the residuals are any less than that, you can flush it with 30 milliliters of water and connect the feeding tubing to the actual NG tube or the G tube that you may be using, and go from there. However, if you are doing a bolus via gravity, you want to make sure whenever the bolus is done that you flush with another 30 milliliters of water, because that procedure is going to be different than if you have a continuous feeding, which in that case you would actually check residuals every 4 to 6 hours just to make sure it's still in the right place. And you also want to make sure that you flush it every 4 hours as well with 30 milliliters of water. And then you also want to make sure that you change the feeding bag itself and the administration set every 24 hours. And then if you actually have a G tube that you're using, you want to make sure you assess the site and clean it daily. And then once you're done all that and you actually have the enteral feeding going, you can doff your gloves, perform hand hygiene, and document the feeding itself, any residuals that were aspirated, the appearance of the site, if abdominal, if they had any kind of nausea, and also intake and output.